All right, let's get right into it. We're going to talk about something you might actually have in your bathroom cabinet right now. But believe me, we're about to go on a wild journey from a relaxing soak in the tub all the way to the high stakes world of an intensive care unit to uncover a secret, life saving identity. For most of us, this is what we see: Epsom salt. You know, that bag of crystals you pour into a hot bath to soothe sore muscles. It feels gentle, totally harmless, and just normal. But what if I told you that inside a hospital, this exact same substance is treated with the respect and the caution of a powerful, high-risk drug? Because, yeah, it is. This quote just cuts right to the chase. In the medical world, this is not a supplement. It's a potent drug, one that doctors reach for when a patient's life is literally on the line. So let's pull back the curtain on this incredibly common chemical. To really understand its power, we have to leave the bathroom behind and step into the hospital, where, as you can imagine, it goes by a very different name. See, in a hospital, it's called magnesium sulfate. And here's the key thing to get. When doctors give this through an IV, they're not just trying to fix a simple magnesium deficiency. Nope. They're using it in high doses specifically to trigger powerful, drug-like effects all throughout the body. So what are these effects we're talking about? Well, at its core, you can think of magnesium sulfate as the body's master relaxant. And all of its power comes from its incredible ability to flip some really crucial biological off switches. So how on earth does one simple salt have such profound effects on so many different systems in the body? Well, the secret lies in its relationship with another crucial element. This right here, this is the whole secret. Think of calcium as the body's go signal. It's what makes muscles contract, nerves fire, and signals spread. Magnesium is the stop signal. It gets in the way of calcium, it blocks it from entering cells, and basically tells the whole body to just calm down and relax. And this one single action, blocking calcium, translates into three really powerful effects. First, it relaxes smooth muscles. That's huge, because it can open up constricted airways during an asthma attack, or even lower dangerously high blood pressure. Second, it calms the nerves by turning down the signals that tell muscles to fire. And third, it literally soothes the brain by blocking the very receptors that are involved in seizure activity. Okay, so now that we know how it works, let's get to the really amazing part, the missions it's sent on, those critical moments where this simple salt becomes a frontline hero. One of its most famous roles is in obstetrics, where it's used to fight a condition called eclampsia. And this is, well, it's a terrifying complication of pregnancy, where high blood pressure leads to seizures that can be fatal for both the mother and the baby. And in this specific crisis, magnesium sulfate isn't just an option, it is the number one, first-line, go-to drug. It has been proven again and again to be more effective than other powerful anti-seizure medications for this exact problem. But its job doesn't stop there, not even close. It's given to mothers in premature labor to help protect the baby's brain, which actually reduces the risk of cerebral palsy. It's the first thing doctors use for a deadly heart rhythm called Torsades de Pointes. And it's used in the ER to stop a severe asthma attack when nothing else seems to be working. The versatility is just astounding. But here's the catch. With all that power comes a serious risk. The very thing that makes magnesium sulfate so effective also makes it incredibly dangerous. There is a razor-thin line between a dose that saves a life and one that can end it. In medicine, we call this the therapeutic index. Think of it like a drug's safety rating. A drug with a wide index is really forgiving. You can be a little off with the dose, and it's okay. Magnesium sulfate is the exact opposite. It has a very, very narrow index, which means it demands absolute precision and constant monitoring. Just look at this table. It's pretty stark. The therapeutic zone, the sweet spot for stopping seizures, is between 4 and 8. But if that number creeps up just a little, to around 10 or 12, the patient's reflexes disappear. That's your first big warning sign. At 15, their breathing can just stop. And up around 25, their heart can stop. The margin for error is almost non-existent. And this is why anyone getting an IV of magnesium sulfate is watched like a hawk. Nurses are constantly running through this checklist. They check reflexes because we know that's the first thing to go. They count every breath to make sure the drug isn't slowing down the respiratory system. And they measure urine output because if the kidneys aren't clearing the drug out, toxic levels can build up fast.
So you might be thinking, if this drug is so dangerous, how can we possibly use it? Well, it's because for every potent poison in medicine, we always try to have an equally potent antidote ready to go.
So what happens if a patient's reflexes do disappear or their breathing slows way down? There is a fail-safe, a rescue plan that is always at the ready, just waiting for a moment's notice. The antidote is calcium gluconate. And it's actually kind of brilliant. Remember how magnesium works by blocking calcium? Well, the antidote simply floods the body with calcium, directly and immediately reversing the effects of the magnesium. A vial of it is kept right at the bedside of every single patient on a magnesium drip, ready to be pushed into their IV and pull them back from the brink. So the journey from the bathtub to the ICU is a pretty dramatic one, right? This quote sums it up perfectly. Epsom salts, or magnesium sulfate, is a cornerstone of modern medicine. It is not a benign, gentle substance. It's a powerful, respected, and sometimes dangerous tool that, in the right hands, can work absolute miracles.
It really makes you think, doesn't it? From a simple bath salt to a life-saving drug, it's a powerful reminder that extraordinary things can often be found in the most ordinary of places. So the question I'll leave you with is this: what other powerful secrets are out there, hiding in plain sight, just waiting for us to understand them?